None of us are immune to COVID-19, but how does COVID-19 impact our area by age and also by race? We're going to be covering that and more in today's To Your Well-Being. Dr. Jay Wyatt is the Chief Medical Officer for Moses Cone Memorial Hospital. So let's get started with these questions. And so the first thing we want to know, is anyone immune to COVID-19, or are there groups that don't need to worry about it?
No. Thank you for having me here, Tanya. And just to answer that question, there's no one who has innate immunity to COVID. Now, there are people who may have been exposed to COVID and have contracted it that may have some immunity, but we have not been able to isolate those people out specifically and show that that immunity either is complete or lasts forever.
Yeah, because I've heard people say, well, I'm not going to wear a mask and I don't need to because I'm immune. And so that does not hold water.
I'm not quite sure where they got that information from and who may have told them that.
But we want to make sure that we're giving the correct information instead of things that you just might hear here and there. All right, so Dr. Wyatt, what do we need to know when it comes to age and COVID-19?
So the incidence seems to be higher in the older population, particularly people over 50 years old. However, the reason we may not be noting the younger generation and the incidence there and the prevalence is because they don't necessarily show symptoms the same way. And also they may not be getting tested as much as you saw in some of the recent regional college outbreaks. When you started to test a lot of those kids, they did show up being COVID positive. So I think some of the differences are in the groups that show symptoms earlier and those that do not.
All right, so we keep hearing the headline, younger people are not as much risk as people over the age of 65, that they don't make up a whole lot of the cases, but I'm sure there's more context to go with that.
I think the biggest difference is that they don't show as severe symptoms, and so they may not get tested as readily. And I don't think that their chance of getting it is that much less. I just think they don't show symptoms. So when they do contract it or may be exposed, they may go for a significant period of time with minimal symptoms.
So how does race figure into COVID-19?
So again, I think we're starting to see larger numbers in the Black community and the Latin community, Latinx community, because we're starting to test a lot more. Because there are significant medical comorbidities in some of these groups, we tend to be affected more severely a lot of times when they have lung disease or maybe heart disease. So I do think we are seeing a larger number. What we see, about 30 to 33% of the Black population in our area has been COVID positive in terms of the overall number of people that are positive. And about 25% of the Latinx community relative to the total group, but that's much higher than their prevalence in the population. So it's sort of a higher incidence of COVID than there are a number of people in the population.
All right, so how do we go about combating that for the Black community and for the Latinx community?
I think they need to follow the same rules that everyone else is, and they are, but somehow try to get them in to see people sooner when they start to have symptoms. You see a lot of people sort of attributing their symptoms to things like asthma, or they have an allergy and it's seasonal. But really, a lot of these people turn out to have COVID and they're not seeing people early enough to get tested. And the only way we're going to sort of curtail more spread is to test early and then isolate as much as possible.
All right, is there anything else that you think we need to know specifically on this before we start getting to text questions?
I think we're doing a really good job of testing. I do think that there are people trying to assume that they are immune because they may have had something before. That is not the case. I think children are not immune to COVID. They just don't have the same immune system and they do not show the same response as adults.
So everyone can get it.
Yes, it can.